Hello, I'm Minarfan Siddiqui and I'm from Group 1. I will be doing the introduction. Durga will present the literature review. Ritika and Latisha will cover the discussion, and Sharifa and Megan will present the results. So, our chosen construct is depression. Depression is defined by the DSM-5, involves experiencing one or more major depressive episodes lasting at least 2 weeks and includes symptoms such as a depressed mood, decreased interest in activities, and feelings of worthlessness. An estimated 5% of adults suffer from depression, making it one of the most prevalent mental health conditions. So, there are several factors that influence depression. Family and twin studies have shown strong evidence supporting the role of genetic factors contributing to the risk of depression. For instance, a meta analysis of twin study data indicates that the heritability rate for depression is 37%, and data from family studies indicate that the first degree offspring of depressed individuals have a 2 to 3 fold increased chance of developing depression. Also, it has been found that heredity plays a particularly significant role in severe depression. Furthermore, many studies have shown a strong correlation between adverse life events and depressive symptoms, with a notable focus on specific types of trauma, such as academic stress, interpersonal disputes, punishment, loss, health related stressors, and adaptation challenges. So, our assignment involves selecting depression as a psychological construct of interest and creating a test with minimum of 15 items. So, the construction of the test is developed on existing theories and literature, drawing upon established frameworks and measurements tools for assessing depression. Following the test development, validity and reliability checks have been conducted to ensure the accuracy and consistencies of the test results. This includes assessing face validity of the test items such as Cronbach's alpha to evaluate internal consistency. Additionally, preliminary test data has been collected from a sample of at least 50 individuals to further validate the test and gather insights into its performance and usability. Legal and ethical consideration related to S administration applications will be discussed, including the consideration for using the test in forensic and special population settings. So that's all for me. Now I will pass on the presentation to Durga. Thank you.
Hello everyone, I'll be presenting a literature review. Today we're diving into the world of feeling blue. But don't worry, we're going to make it fun and easy to understand. So, what's depression? Well, imagine feeling super sad and hopeless for a long time. That's what depression is like. It's like a big rain cloud hanging over you all the time, making you feel sad and hard to enjoy things you used to love. But how do we know how bad it is? That's where depression scales comes in. They are like the tools that help us measure how big that rain cloud is. So now moving on to the theories related to depression. Now let's talk about why we feel and how we understand it. Imagine you have a pair of glasses that makes everything gloomy. That's kind of what happens with depression. Some people have a special way of thinking that makes everything seem sad and hopeless to them, even when it's not. We call this gloomy glasses theory, but depression isn't just about our thoughts. It's also about how we interact with the world. Sometimes things like fights with friends or bad stuff happening to us can make us feel really down. That's where the behavioral, interpersonal, and traumatic event comes into. So behavioral means how we act. When we are depressed, we might not feel like doing things we used to enjoy, like hanging out with friends, playing games. Interpersonal is all about our relationship with others. If we have lots of conflicts with friends or family, it can make things even worse. Now, moving on to measurements of depression scales. Let's measure those feelings. Now, let's see how we measure all those gloomy feelings we spoke about earlier. Ever heard of a mood thermometer? Well, the Bad Depression Inventory, which is known as BDI, is kind of like that. It asks questions to see how sad and hopeless we feel. And guess what? It's also pretty reliable, which means it gives us consistent results every time we use it. Like, according to a study by Garcia Batista, not the WWE, the BDI has been shown to have a good test retest and validity that ranges from 0.73 to 0.92, which is a good reliability rate. And now, moving on. Now, imagine we have a checklist of feelings. That's the CASD. It asks us about different emotions we have felt in the past, like feeling down, not being able to sleep. There's even a short version called CSD10. That's super handy. Like based on the study conducted by Zhang, tested the 10 item CSD, the shortened version, and found the CSD10 had good internal consistency reliability coefficients Kronberg 0.88 among the respondents undergoing antiretroviral therapy. So there you have it. With these cool tools, we can understand and tackle all the gloomy feelings together. Have a nice day.
So, I'll be talking about the legal issues in Malaysia. So, the first legal issue here is the Mental Health Act of 2001, which addresses the legal detention of someone who is not mentally competent to make decisions for themselves. This act also states that if the client or patient is not competent to make a decision for themselves or to give proper consent for the depression test, then a caregiver or relative may be able to give consent for them. However, it is very important to give consent for a depression test. The individual or the client must do so. Next is the Personal Data Protection Act 2010, also known as PDPA, of Act 709. This act places strict limits on gathering and handling private health information such as the depression test results. This law basically is there to govern the personal data of individuals or clients when they are administered with a test. Individual consent may be required to obtain personal information from the client, meaning consent is definitely needed in order for anybody to do a test, especially a depression test.
The depression test that we have created can be applied to forensic assessments as well. According to the American Psychological Association, forensic assessments are a systematic evaluation by a mental health practitioner of a defendant, witness, or offender to inform the court about issues such as competency to stand trial, criminal responsibility, and risk assessment. So this would include family history, criminal records, and psychological testing. And a connection would be needed between the defendant's actions and the mental disorder in order to form an opinion or diagnosis of the individual. So because of this, the test can provide insight into the mental state of the test taker, as there are cognitive deficits which are associated with the diagnostic criteria for depression. Specifically, the test can be used to gauge the mental state of a defendant, witness, or offender and their competency to stand trial. So this is because the cognitive deficits associated with depression may cause the individual to lack the self-interest and motivation to weigh and consider information to reach rational decisions related to criminal proceedings. As a result, the individual may be incapable of understanding the nature and objective of the proceedings, and this would then make them incompetent to stand trial.
Moving on to the next part of our discussion, which is the challenges in administering to a special population. Special population basically means people with disabilities or elderly population. The first one is communication barrier. Individuals with cognitive disabilities may find it difficult to comprehend the test questions, and as for children, they may have difficulty expressing their feelings and thoughts, as they may not have the proper vocabulary. It is also found in a study that people with autism or any kind of intellectual disability frequently may not receive proper treatment for depression due to their communication issue. Moving on, sensory sensitivities. Individuals who are autistic tend to be oversensitive or hyposensitive to their surroundings, which is basically they may be oversensitive to the light or to the sounds in their surroundings, or they may be hyposensitive in a sense where they want to be close to the light or sound. Children who are overly and underly sensitive to their surroundings are found to be difficult to test for depression, especially when they have a cognitive impairment.
As for the challenges that arise when developing tests across countries and regions, two main concerns involve validity and standardization. Validity refers to the extent to which a test measures what it claims to measure. This is affected when test items are translated because properties of inappropriately translated items would change for individuals taking the test in a different language. As a result, questions would need to be modified to fit an occurrence that would be realistic for people of a specific country. This would then lead to a need for test adaptation in order to measure the same construct in a new language and culture, which can be more costly and more labor intensive. As for the issue of standardization, which is in regards to how standardization is the use of uniform procedures to ensure all participants take the same test under the same conditions and are scored by the same criteria, ensuring all results are comparable. This is an issue because cultural differences impact interpretations of questions on a test. As a result, misunderstandings in communication can affect the identification of depression, which in turn can lead to a misdiagnosis or underdiagnosis of people according to their racial or ethnic group.
So, moving on to test purpose. The purpose of this test is to determine the degree of depression symptoms in individuals. And besides that, it's also to gain insights into mental well being. And then lastly, it's to develop a reliable and valid assessment tool that measures.
As for the test construction, we referred to the Center for Epidemiologic Studies depression scale, and each item was paraphrased. The internal consistency for our test is 0.921 using the convex alpha. As for the validity, we used the Pearson's correlation and found the value of alpha less than 0.001. As for the scoring procedure, our test is a 15-item test with 4 scores ranging from 0 to 3. As for the highest total, it is 4 to 5. So individuals that scores higher indicates higher symptomatology.
So the last part of test construction is pilot testing. So pilot testing is when the initial version of the test is administered to participants. So in this test, we had about 50 participants, and the data is collected to assess the test items' validity and reliability. For the test, participants were asked for electronic consent and to complete the depression test. And to measure the internal consistency of the test, we use Convex alpha, and to measure the validity, we use Pearson's correlation.
So, in conclusion, our depression test has been proven reliable and valid through convex alpha and Pearson's correlation, respectively. The use of it has also been examined from various perspectives, including the legal issues in Malaysia, its application in forensic assessment, its administration to a special population, and the challenges arise when developing assessments to be used across different countries and regions. That is all from our group. Thank you.